Look, our hearts just go out, don't they, to all of the families who are being impacted by this. As you've said, we unfortunately do need to anticipate that there will be further deaths, and it just makes it so imperative that initiatives such as the one that we're announcing today that the Prime Minister and Minister Hunt have signed off on are just so critical. We must be there to support all Australians, but particularly our hearts go out to all of our colleagues in Victoria at the moment. It's just such sad news.
$31 million has been set aside to create 15 mental health clinics. So specifically, how is that used? How does that treat the problem?
The problem is that we are seeing increased numbers of people needing some mental health support, and for quite severe presentations, like you said, self-harm, etc. What we want to avoid is them going to our emergency departments. So the focus has been on how can we reach people in their community settings. By that we mean in GP clinics, in our headspaces, in other places they're familiar with, and provide not only access to GPs, but access to mental health nurses, social workers, psychologists, really importantly, and also at this time we also need access to those who work with drug and alcohol, so that people can actually go to one place. When they're there, they will be what we call triage. That really means that we'll be able to say what level of care do you need and how can we best provide that. Can we do it here at the clinic? Do we take you somewhere else in the community settings? What do you need to support you at the moment? So that's the focus, and get it away from our hospitals.
Presumably, people are calling for help because they've lost job because of money issues. So how do you fix those problems without providing a job for them? Is my point.
And I think this really shows us this is right across government. There is really probably no lever of government that we don't need to call on at the moment. So you're right. Financial stress is very real stress. So the best thing we can do from a mental health perspective is firstly acknowledge that. Secondly, make sure that people have access to mental health supports so that they can be provided with the strategies and, if need be, the treatment that will help them. One thing we do know is that as we go through this very long journey, our mental health and our mental well-being, if we invest in it, will actually underpin how we go and come through. So I think that's a really important part of the overall way we manage.
But what do you do for someone who's lost a job? What is the treatment? Is it just having someone to talk to?
It really depends. You see, we use these two words, mental health, to cover so many things, don't we? For some people who may be more resilient than others, what they may need is somebody to talk to actually try to reframe some coping strategies. Other people, it will present in very escalated levels of anxiety and distress. For those people, we do need to give them psychotherapeutic approaches. We need to give them some treatment and support. And for other people who may actually have mental illness, it could actually trigger a more significant reaction. So when it comes to mental health supports, it's everything ranging from counselling and support and talking through to therapies that we deliver, through to, if necessary, some medications to provide support. So it really depends on the person.
What are the demographics here, Christine? Is it mostly young people?
Oh, if only it was one demographic, and that would make it easier to wrap our arms around. I think the important thing is we recognise that every group has different vulnerabilities. Our young people, for sure, particularly our young people who are grappling with that the last couple of years of school and feeling, gosh, where are we going? And we say to them, don't lose hope. The future still is in your hands. But what about our older Australians, as we've heard this morning, our people who live on their own, those who are lonely, people who are parents and carers. So there's so many different groups that we need to say there's not one size fits all with mental health. We actually need to meet the people where they are at and understand what's causing their heightened anxieties. And for those who are depressed, what is causing it, and then find an answer that best suits them.